Good morning, everyone. What is trust? What is trust? If you take the book of Barbara Mistal from 1996, she says, trust can be a silent background, sustaining the unproblematic, smooth running of corporate relations. It can also help people to reconcile their own interest with those of others. It's a possible definition. I think it's not a bad one. So regarding this panel that we will now host here on stage, I think one sentence from that book is very important because she says there, but above all, trust by keeping our mind open to all evidence secures communication and dialogue. So I think this provides a really useful approach to focus our central question: can artificial intelligence enhance communication and dialogue on issues where scientific evidence is pertinent? This is basically the topic of this morning's panel. So on behalf of the Max Planck Society, I would like to extend a very warm welcome to all of you. Thank you for joining this morning. Maybe just for you to plan a little bit, we will have 45 to 60 minutes for the panelists, where we engage in a lively discussion, where they also will present some of their ideas about the topic and some of the research and the work that they are doing. And then there will be time for questions. So I already ask you now to think about those things that are close to your heart, that are of interest to you, and maybe prepare some really good questions for the second half. We will have then another 30 minutes or so to take care of your questions. And it would be really important that we engage in a dialogue, because we all have very limited time, so you should get out of this event by saying, I could get an answer to my question, or I learned something and I know what the next steps could be. So the Max Planck Society has been working with the World Health Summit from the beginning, from 2009, with great pleasure. And we're looking forward to the debate, of course, today. You all know how important trust was during the pandemic, right? Remember, in the first year, we were all thinking it's a biomedical question, right? We have to sequence the virus, and then we have to develop a vaccine. And once we have the vaccine, we can fight the virus. But then soon we realized that in the end, once you have a vaccine, which, by the way, was a wonderful success of biomedicine, one must always emphasize, within 10 months we got an mRNA vaccine against the coronavirus. But then once the vaccine was there, and even beforehand, people, of course, started to worry in the health sector, how can we get people to actually take the vaccine? And there has been enormous differences, even within Europe. In Germany, between 60 and 70% of the people got vaccinated, but in Scandinavian countries it was above 90% in some of them. So huge differences. So there must be huge differences in the trust in science and biomedicine. Maybe as a word of introduction also, you've seen the Nobel Prizes in chemistry and physics this last week, and it was quite amazing that both prizes actually went to AI. One should say that one was more on the fundamental side, the physics prize, and in chemistry was more applied. Remember, there were the two people from DeepMind, and this was the prize for AlphaFold. So maybe so that we're all on the same page, AI was used and was trained actually with a huge protein data bank, and is now used to predict any protein structure that you would like to predict, and actually for most cases with very high confidence. So a huge breakthrough. AI is now something that has really arrived at medicine, and it's accelerating research, but also accelerating biomedical applications. Now, as I said, foundations, machine learning, the algorithms, the deep learning methods, this is, on one page. but of course, on the other hand, we have the application. Think of the large language models, think about improved search functions and so forth. Think about assistants that are around the corner that can integrate expert knowledge and assist experts. So we are at this, in this special situation where we move from the foundations and from the developments to the applications. And in particular, I think the health sector will be transformed by these AI applications. So you can already see the issue that we will have and that we will discuss on the panel. On the one hand, of course, we hope that these new tools, these machine learning tools, these large language models, the chatbots, the AI applications, that they will enhance trust in science, in medicine. But on the other hand, of course, people also need to trust those tools. So it's a little bit like a catch-22, and we will dig into that issue. How can we make sure that in the end we can increase and enhance trust in our work, in science, in research, but also in medicine? I want to just tell you about a few examples that are coming up. For example, the help desks, right? You have now multilingual help desks that can provide basic medical advice. Or think about health communication campaigns. They can use AI, they can tailor most of the messages to target groups, even to individual users. AI also has the potential to provide users with an understanding of large amounts of unprocessed data. These are the expert systems, but also think of transparency that can be increased in medicine in this way. And finally, think about the issues of privacy, the concerns associated with privacy of data, of information. And many of those data that we deal with in medicine are, of course, very sensitive. They are patient data. They belong to the patients here in Germany. And how can we use AI to approach this issue of privacy and the concerns that patients may have? I just want to, before I bring the panelists on stage, I want to just cite from two studies that came out recently. So one was in Science only last month, and it actually shows that AI interventions are a tool to convince people of evidence. This is great news, but when you actually read the article, you see that we're still at the beginning, because what the authors found is that short chats with GPT-4, on average chats of 8 minutes, they were sufficient to durably reduce a wide range of conspiracy beliefs, but by average only for 20% of the users. So on the one hand, we can measure an effect. Such AI-based tools can make a difference. People begin to trust in evidence, but then on the other hand, you only reach 1 in 5 in this particular study, so it's still a long way to go, much room for improvement. We're at the beginning here. Second example, also a very recent study. It has been accepted for publication, but I don't think it has yet appeared. It's in press, and that actually involves also a Max Planck researcher amongst many other authors. One researcher here from the Max Planck Institute for Human Development at Berlin. And in this study, researchers found widespread trust in scientists actually across 68 different countries, using almost 72,000 respondents. So we do see that there is trust. Trust is, of course, different in different regions of the world. We see a higher level of trust in science generally in the Western world, Europe, Northern America, also Australia, and less in Asian countries. This is on average. Of course, there's differences between countries, but there's a trend here. And of course, we would love to also understand better why that is so. There's, of course, the cultural background, but there's the educational system and many more influences. Now it's time for me to call our panelists on stage, and please welcome 4 exceptional leaders who actually come from very different fields and who will have, I think, bring many different things to the table. And the first one is Lucy Gilson from the London School of Hygiene and Tropical Medicine and the University of Cape Town. Please welcome her. Lucy works on health systems resilience, and our second panelist is Jeremy Farrer, who is Chief Scientist at the World Health Organization and has been, welcome, and he has been before Director of the Wellcome Trust that you all know, a very important foundation in the UK. And then we have Roland Illing, who is Chief Medical Officer and Director of Global Healthcare Nonprofits at Amazon Web Services. Roland is very interested in the question how AI can drive innovation in health equity and also health sustainability. And now finally we have Mia Cha, who is the Scientific Director at the Max Planck Institute for Security and Privacy in Bochum. Welcome. Mia is really at the forefront in research for computational social science, and she published a lot on social information, but also the interaction of humans with machines. Now let me move over and then we get started. And please don't forget in the meantime to think about your own questions that we will ask shortly for. Yeah, welcome everyone. Thank you so much for coming to Berlin on a Sunday morning for this very important topic. I really appreciate it because all of you have, of course, a lot of things on your agenda. I would like to start with a more general question, and you should also feel free, if you don't like the question, that you just in the beginning say those things that you wanted to bring to Berlin. Because the worst that can happen is that you leave the panel and you weren't able to say what you really wanted to say. But my question is, of course, about opportunities and also concerns. These are the 2 sides of the medal, right? AI offers these opportunities to improve transparency, to enhance trust in what we are doing in science, research, and in medicine. But on the other hand, of course, there's concerns. Do people trust AI? But also, do companies and do those who apply AI actually do it carefully? How can we, make sure that this is the case? So this is the 2 sides of the medal. And it would be great if you just start by saying what your first thoughts are about this issue. Maybe Lucy, you would like to start with that.
Sure. Good morning, everybody, and thank you for the opportunity. So I want to explain a little bit to begin with about the work I do before I go on to the question. So I am a social science researcher who works on understanding health systems and health policy change. And I understand health systems to be about people, relationships, and routines. And those are the systems into which AI will be implemented in one way or another. And I'm interested in understanding how, if and how, AI, as it is used within health systems, might build public trust in science more generally. So that's the premise that I'm starting with. So if we think about trust in health systems, we need to recognize that they're made up of lots and lots of relationships, and the trust in interpersonal relationships is very important. Clearly, the provider-patient relationship is at the heart of the delivery of healthcare. So trust in that relationship is important, and perhaps we need to think then about what builds trust in that relationship, and it's partly about competence and being able to treat, the provider being able to treat the patients, but it's also about care and empathy. We also have to understand that the patient-provider relationship is nested in a wider system, a financing system, a governance system, a system that distributes drugs and other medical supplies. So if we're thinking about applications of AI and the potential for building trust through the health system, it's not enough just to think about the patient-provider relationship. One also has to think about the broader system in which that patient-provider relationship is nested. So how could AI enhance public trust through health systems in science? And health systems are so important because, when we are, any of us, ill, we are vulnerable. We go to a practitioner, we seek care. At that point, we want empathy as well as good treatment. So perhaps AI could help in strengthening provider competence and in providing tools that enable providers to offer competent care that patients appreciate, and that might build trust in that patient-provider relationship. I don't know, and I'd be interested in understanding from the panel whether it can build empathy, which is an extremely important part of that relationship. But I'm also interested then in whether AI can assist in the strengthening of the system, the platform that underlies that relationship. You said we could raise concerns and issues. So I work in South Africa. My experience is predominantly in African settings and in some Asian settings. And I also would like to know a little bit more from the rest of the panel about how we're going to manage inequity, because we know that technological innovations are always distributed inequitably, in fact, between the global north and the global south and within countries. So will AI actually bring benefit to low and middle income countries? Will it be available? Will it be developed in ways that address particular sociocultural and language issues? And I'd be interested in knowing more about how we're addressing those questions, because if it's not available or it's inappropriate, it can't build trust. I also want to know a little bit more about what we're going to do about the systems into which AI is going to be embedded. So I work in South Africa. It's a wealthy country. It's an upper middle income country, in fact. And in the development of technology, something like patient records, we still have quite a lot of paper patient records, not even e-paper records. We also have settings where accessing the internet is very difficult, where doctors use their own cell phones and data to be able to access whatever electronic information is available. So how are we going to build the system in the first place that then perhaps can provide a platform for AI's uses? Because we don't build that system, again, the benefits of AI will not be available more widely. So ultimately, I'm interested in knowing from the panel how AI can enhance and strengthen the sort of everyday practices of health systems that ultimately could build the patient and the public's confidence in those systems, and in that way contribute to public trust in science. Thank you.
Well, thank you so much, Lucy. Maybe a little disclaimer. Here in Germany, we're just about to go from patient records on paper to electronic records. We are really behind because of the strong data protection laws in Germany and our special history. But it's now coming. But we know what we're talking about when we talk about paper records, because obviously that means data are not available for research, right? You need to first digitize them, and you need, of course, to get the consent of the patients. But I think your question, I should maybe ask Roland. He will not be able to answer all of them, but I think it's a real concern. Will information be available to everyone? Can we democratize the system? What about these AI-based tools? Will they be affordable? Will they be available? What is your take on this?
First of all, thank you very much for the invitation to speak. It's a pleasure to be here at the World Health Summit and to be on a panel with all of you. My name is Dr. Roland Illing. I'm the Chief Medical Officer and Director for Global Healthcare and Nonprofits at Amazon Web Services. And just to be very clear, that's the technology arm of Amazon, which is providing cloud infrastructure and global computing, rather than Amazon.com Health Services, which is, you may have heard things like Amazon One Medical and Pharmacy and PillPack, which are direct-to-consumer services based in the United States. So we're very privileged to be able to provide technology infrastructure to national governments and to states, health systems, to strengthen their healthcare infrastructure for the delivery of care to patients. By way of background also, I'm an academic interventional radiologist, and I trained in both surgery and interventional radiology, and I'm still a faculty member at University College London. So just a bit of background. When it comes to that question about, I first of all think this is a very interesting topic. I think the whole topic of can AI strengthen assurance and enhance public trust, it does predicate your assurance already and your trust in AI and those systems. And so as part of a large technology company, we are incredibly focused on earning trust with end users and making sure that that trust is verified at scale and around the world. So we take trust very seriously as an organization. And it really is trust in the cloud that underpins trust in AI, because the amount of computing power now required to deliver some of these AI advances is actually not possible without cloud computing, because cloud democratizes access to vast amounts of compute, storage, and networking, which actually allows these latest technologies, these foundation models through generative AI, actually to be built. It's important also to understand that health systems already run in the cloud and leverage this technology. And again, this awareness is really important to understand in order to grasp the scale of change that's taking place globally at the moment. We're going through a moment of unprecedented global change with regards to the technology footprint that we're all using. So, for example, the UK NHS Spine, which is the data service which transmits clinical data between institutions, runs on AWS today. So it connects 44,000 clinical IC systems across 26,000 organizations, exchanging 42 million messages per day between 500,000 professionals. I mean, these kind of data is very, very impressive in terms of the scale of operations which are required to manage big health systems. And talking about digitizing health systems, it's this kind of technology which is really important. The US Food and Drug Administration, the FDA, has built their intelligent data lifecycle ecosystem on top of AWS, and they pass 300,000 new drug and device requests per year. And again, the amount of information that comes even with a single drug or device request for approval requires millions and millions of data points. So you can see the scale that's also required is incredible. My last data point there is India. So we're working with the Indian Ministry of Health for their PMJ system, which is their national insurance program, where they're assuring their citizens, the least well off in India, with a basic health insurance program. And that platform processes 900,000 claims per month across the whole of India, and has issued over 350 million insurance cards and connects 17,000 hospitals. And these are programs which require this really important technology infrastructure as a backbone. So already national programs rely on these systems and trust them, but it's also important therefore for the general public to also understand this technology change is taking place and also therefore have trust in the system.
Yeah, well, thank you so much. I think we have to also at some stage discuss not only what it costs, but also the energy it costs and where we get it from and how we do that in a sustainable way. That's another, because that also I think has to do with trust amongst the users, how we provide the technology.
Well, I think we can get into that in terms of the carbon cost of healthcare is a totally different subject that's probably been discussed in another room, but that in itself is very interesting that we can talk about.
But Jeremy, please.
Go ahead.
I think you should, whatever you bring to the table is important for us.
Well, like everybody else, it's a pleasure. It's a pleasure to be here. And Patrick, you and I were together just 2 or 3 weeks ago on a similar related topic, actually, and pay tribute to the World Health Summit for pulling these panels together and addressing some challenging issues. I was privileged actually to be at the very first World Health Summit here, and it's grown enormously since then. And I think the organisers deserve great credit for making sure it has become a much more inclusive and diverse approach to the way World Health is discussed. So my own background is as a clinical scientist. My experience is more from Asia, having been born in Asia, but also then spent 20 years as a clinician working in Ho Chi Minh City in Vietnam, and then head of something called the Wellcome Trust in London, and then for the last year in the World Health Assembly, World Health Organization in Geneva. So I've seen it from obviously also a patient's perspective and a family's perspective, but I've seen it from a clinical scientist's perspective, a funder, and now from a public health agency. And those are three very, very different cultures, which maybe we can come back to. I'm not a social scientist, I'm not a historian, but I'm going to start my comments from a historical perspective and, Lucy, sorry, a social science perspective. Firstly, I think we are in, and sometimes you don't appreciate it until you look back, I believe we are in a scientific golden age, when the progress in science is absolutely staggering and can be at times quite frightening, because it is moving so fast. And I think at various moments in history, science isn't linear. It doesn't go along a linear path, gradually progressing. It goes through a series of leaps, and I think we're going through one of those series of leaps at the moment. And when you go through those periods as a non-historian, but you look back now in history at other times when that happens, society asks some really tough questions. And so it should. Because science has to be part of those societies in which it thrives. And so as scientists, or as people working in that scientific and technological field, we shouldn't fear or be negative about the challenges that society is providing to what science does. We should embrace it. We should embrace it, because if we want to allow the equity, and I'll come back to equity in a minute, that Lucy talked about, then the only way of doing that is to increase the trust. And ultimately, and now a social science comment, which I hope doesn't go negatively with the social scientists in the audience, ultimately, I think trust is about power. And when you have power imbalances, then trust increases. And I think one of our great challenges in this scientific golden age is if we are passive, the very science that we all wish to get done will drive greater inequity, not reduce inequity. Science will increase, and technology, and I put those together alongside innovation. They will be driven by a smaller number of people in a smaller number of countries, often competing across those countries in today's geopolitics. They will go on often not in the public sector, and that's the right place to do it. But the private sector is becoming also fragmented between a private sector that are publicly listed companies, where there is a degree of governance and transparency, and private sector in private hands. And private sector in private hands for longer before going public. And that is not as transparent as publicly listed and public traded companies. And so therefore we have the traditional public sector, we have the traditional private sector with the governance and transparency around that, and then we have the private sector. And I worry that we don't have the governance structure that covers all of that.
Well, that will lead us maybe also to discuss policy later on and how that differs in the world. Sorry, but I interrupt you. You have another important...
To finish off those comments. So I think if we are passive, we are not passive drivers of history. If we are passive, then the very science that we want to do at the moment will drive greater inequality if we are not. And the way to address that is the democratization that Roland talked about, but it's also about shifting the center of gravity. It is about removing the barriers to entry to allow that to happen, and rebalancing that power imbalances that currently exist of the so-called North and the so-called South. And unless that center of gravity shifts, then I think we will see an increasingly inequitable world, and when we see inequity, we will see conflict. That's how important this is. And I think we have a short time now, a short window, given the dynamic speed that science is moving at, to actively address this rather than think it will passively trickle down. That's our responsibility.
May I just add to that? Because I think that scientific golden age comment, I think, is absolutely true. And I think just to make a data point against the comment that you made in your opening address, Moderna, that developed one of the mRNA vaccines, the time it took for them to come up with a putative vaccine candidate from the time they were given the COVID genome, which would normally take months and months of experimentation to determine what that would look like, it took 48 hours using high-performance compute in the cloud. We were able to support them, but they were able to come up with that putative vaccine candidate in absolutely exponentially faster timescales than was previously possible. And that's the kind of scale of the technology that is now being brought to bear against some of these problems. But just because you can bring a really good cure does not mean that it will be accepted. And so
or equitably distributed.
Or distributed, exactly.
Now we're in the middle of the discussion.
Absolutely.
That's
So that's the point. So it's just having good tech is not enough.
Yeah, that's wonderful to be in the middle of the discussion, but I want to give Mia a chance to spend 5 minutes and first introduce her research or her take on the question, because you are really in between AI and social sciences.
That's right.
So please, Mia.
Yes, so really wonderful to see everyone here, and good morning. I'm coming from South Korea, recently joining Max Planck Institute as a director. My background is in computer science, but I've always been drawn to how critical information in our society propagates, for example, fake news or poverty or depression, frauds. How are they spreading? Can we use computational methods to detect them? And what are the ways that these algorithms can actually be used in practice, not just being published as papers? So I have been collaborating with many NGOs, and moving to Max Planck, I'm really excited to be in this global stage and have more connections and have our work, work really be used more widely. So some of the research that we do is to track fake news on social media, and we just don't look at the messages, but we look at the patterns of how they are spreading and whether algorithms can be used to make an educated guess about the content, and then we give it to the fact checkers and so on. So, and then we're looking into the use of AI and computational methods and apply them to new data sources, amazing data sources with multimodal data using satellite images, text images, videos. And all of these could be used for improving healthcare, well-being of humanity. So my research group is called Data Science for Humanity. So I'm in that place where we are using AI computational methods, but our problems are really looking into critical social problems. So we are obviously using the latest AI, the latest tools, but the challenges that I see when we're building all these models is that a lot of the data are currently trained on data from wealthier countries. So that means that these algorithms are going to be very good at making predictions about certain demographics, certain ethnical groups, or certain countries. But we need to have more data from diverse groups. And I think this is something that we can collectively talk about and we can contribute to solve. So I'm really looking forward to having that conversation here.
So would there be a simple answer to the question of our panel, how AI can enhance trust? Is there anything from your studies where you say, oh, that's the one thing which we always have to take care of?
AI, so before I would see science, we had some understanding of how scientific mechanisms operate. We have exact mathematical equations that explain our physical world, our chemistry and everything. But AI is a little bit different. It has so many parameters. It looks like it's a black box. It's really hard to understand. Even for AI researchers like me, it's really hard to understand why certain decisions are made. And often the explanations are post hoc, meaning that after the decision is made, there are some ways that you can look into how the decisions are made. And I think there's a little uncertainty or insecurity about, do we trust these AI systems or not? So there are models that are closed models, open source models, and there are many ways that I think we can trust the use of AI. One of them could be making it open source, put it up to the open public for scrutiny that would strengthen the system, and also make all of these outcomes really publicly available so that they can be cross-checked and validated.
Thank you. Lucy, maybe coming back to you, how can governments or also institutions in public health integrate AI into the healthcare systems in ways that can enhance transparency, accountability? You already alluded to the problems, of course, when you have low resource settings. So what would you recommend if you would advise institutions or governments? How should they deal with these AI tools? How could they use them, and what's your recommendation?
Gosh, I have the power. Well, I think we have to take on board what Jeremy's saying about power and the distribution of power in the world and in society at large and in health systems. And I think that power underlays the way health systems work. And so the integration of AI into those systems cannot ignore the existing power differentials. So in some senses, we have to firstly confront those differentials in order to create a level playing field for everybody. So there's been a discussion about, it can help democratizing access is an important issue. I'd like to know more about how we democratize access if the access to the cloud is actually dominated by northern partners, for example. And I think governments need to ask these questions before they start saying, how do we integrate AI into health systems? And then I think we need to think about the uses of AI that improve the everyday functioning of systems, because that's what people experience. They don't experience, I'm afraid to say, the very large language database analytics that then may generate changes in the way the systems function. They may experience AI, I don't know, in improvements of drug availability, and I'm talking in low resource settings. Maybe it's true in high income settings. They may experience AI in being able to better understand the health services that are available to them, where they can go, when they can go, and how they're open. I'm using very small-scale examples, but to illustrate the importance of the everyday in the way a health system works. And so I think governments need to think about how to use AI to enhance the everyday. I'll give one specific example. I asked a colleague in South Africa who's working on clinical innovation, actually, in health systems, what he felt about AI and the use of AI. And he said there was a really good example that he was really positive about, which is a bot to mentor leaders and newly appointed leaders in health systems who haven't previously been in managerial roles, clinician leaders, in fact. And he said it's really great because it's quite expensive to offer mentorship to leaders in a health system, but the bot can give you some support and confidence. So for me, I'm looking for AI applications that strengthen the routines of the system. And I think governments also have to question the power inequalities that will generate health and health tech inequalities.
I guess you have to go broad if you want to make an impact. But I think in the UK you're pretty far ahead. Don't you already integrate AI tools? You have a very unique system.
I imagine others will know more about the UK than I do, I'm afraid to say. I actually live in South Africa and work in South Africa, even though I have the London School link. So I leave it to others to answer that.
But Jeremy, please take.
I think I'm right in saying that the UK National Health System is still the biggest user of a fax machine. So I'm not sure that you could point to the UK as being the... Apologies to the UK government in the audience.
Don't tell anyone.
You asked the question about what governments can do, and I do think that's an absolutely fundamental question. And I think governments need to know what they can do and what they can't do. They shouldn't try and do stuff that government should not do, which are better done in other parts of the system, including the private sector. But what governments do need to do is make sure that they're forward-thinking and anticipating what is coming, rather than one of the challenges we have in the world at the moment, in my view, is that our political cycles are very short. And the politicians, particularly in the health sector and the education sector, and the innovation sector, those ministries are often quite short-lived in their ministerial time. And so their horizon is very short. An electoral cycle, or your Minister of Health might be a Minister of Health for 12 months, 18 months, and then move on. So their driver incentives are very short-term. I think what governments have got to get better at, and I hope we can help with that, is anticipate what's coming instead of reacting to it. And thinking how can one build equity into it, how one can build access into it, and how, yes, critically here, how we can build trust in it. But if we're always reacting in the public sector to advances and science and politicians and diplomats diverge, then I'm afraid we'll be reacting and reacting negatively. So I think anticipation becomes a critical factor.
Can I pick up on that?
Please.
Just briefly, because the point about the political cycles is important, but the advisors in government who stay longer are therefore, I would think, Jeremy, an important audience to work with to maintain a trajectory of change. And so how do we engage them is a question as well. Thank you.
Roland, would you agree with that?
Yeah, well, I've got one comment on what Mia was saying and another from Lucy. So in terms of the governance of the way that AI is built, I think is really important. And I think that the trust in the systems that go to build AI is key. So as a tech provider, we provide the tools for those organizations to build the next generation of solutions on top. But we ourselves endorse the White House voluntary AI commitments where we are producing AI tools ourselves. We provide AI service cards against 8 domains of responsible AI. So you can actually understand how the model is working, what goes into it, the data that underlies it. We have tools actually built into the platform, like SageMaker Clarify, which actually can look for bias in the data sets that are being used to build AI, and also look for model drift. And also, we just recently were one of the founding members of the Coalition for Health AI, CHAI, as it's been set up in the US. So we take the governance of the way that AI and how it's being built incredibly seriously. Now, where it comes to the delivery of AI in the field, I think AI has a real role in order to enhance the public trust in science. I think that's in itself very interesting. And to your point, Lucy, in terms of I think there are 4 real areas where AI can lean into this. And the first is around the capability to make health information consumable. I think that's really important. And the example you gave was a bot that could sort of help mentor. We have a startup, we're working with a startup called Huron AI in sub-Saharan Africa, and it was actually built out of Washington State in the US using a data set from sub-Saharan Africa. And it was really to democratize access to oncology care. So in Rwanda and Kenya, for every 3,000 patients with cancer, there is one oncologist, whereas in Washington State, for every 300 patients, there is an oncologist. So there is a massive disparity in care and access. And using some tools like generative AI, you can create care pathways which are accessible in the local language, in a culturally sensitive manner, tailored to the local requirements and the availability, because obviously the amount of capability and resources are different in each country. But using some of the modern tools, you can tailor these pathways in a much faster, more culturally sensitive manner. So Huron is an example that I think is really important in that environment. I think reducing variability in clinical practice is important, and again, AI will have a really interesting role to play. As you know, it takes 15 years for any discovery to reach widespread clinical acceptance, and 15 years is a very long time. And so things can become known in the literature and be apparent to those who are delivering it, but it won't make prime time for a very long time to come. So how can we reduce that cycle to get into prime time? An example of that is working with Genomics England. They use biocuration. So they look at vast amounts of data to look for gene associations with disease. And they have an army of biocurators that look through the published literature, hundreds of thousands of journals, saying what are the associations that have been published between genes and disease that can then be targets for future medicine.
Okay.
So we worked with Genomics England to build a biocuration framework, and they used that, and they have identified, a 12-week project, identified 20 new genes to look for learning disability and learning impairment in young newborns and the young, and they found 20 new gene associations which were previously not discovered by using this technology. So again, democratizing access to the tools is really important.
Well, thank you so much. This makes a lot of sense. Yes, resonates with me. Mia, tell us a little bit more about your work. So, and especially how should AI systems be designed, and do we need to regulate them? Of course, that will maybe slow down process, but there seems to be some need to regulate.
Yes, so just following up on what you have shared, so I really feel like there's a lot of opportunities that AI can bring, but from our previous collaboration with NGOs like World Customs Organization, sometimes we build the best algorithms that has the highest detection rate in frauds, tax frauds. But once we share the codes, we quickly realize that there are no GPUs in the corresponding receiving countries and the experts to run these systems. So our project quickly turned into capacity building. So we have these algorithms, but then we started training the local customs officers, and we work with wonderful people in Nigerian customs office. So I do think the algorithms and the AI could have so much potential, but also there's the capacity, and we all know these AI models need huge compute. So there's how do we democratize AI? That has to do with a lot of the compute issue and capacity building, not just making the best algorithms at all. So that's one comment. And if I can spend a few minutes talking about my research, I have a few slides that I would like to share. So my research is really into looking at using AI computational models for looking at critical information, and one of the topics we look at is fake news. And during COVID, we really saw how misinformation could have harm, like rumors like, drinking strong alcohol can kill virus. It spread so widely. These are misleading practices, but it also led to death of hundreds of people. And at that time, when COVID started, I was in Korea, one of the early affected countries. As a fake news researcher, I really took care into looking at information that's spreading. And what we realized was some of the rumors that we see on COVID had already been fact-checked a week before in China. And then they started coming up in Korean social media. And then a few weeks later, we saw the same claims circulating, resurfacing in different languages. So we wanted to make use of this observation. We gathered international scientists, and that's how we got to launch this public campaign called Facts Before Rumors. The idea was that we wanted to disseminate fact checks even before it reaches some of the countries, because many countries were pre-COVID at the time when Korea and some of the early countries were affected. So here are some of the examples that we have. We collected claims from Korea and China. We also talked with health practitioners to make sure that some of which rumors might have global appeal. We matched fact checks and we put them into infographic that's really easy to see. So claims along with fact checks. And these images were tailored for low resolution mobile phones because we wanted them to reach everyone regardless of their device. And we quickly understood to really reach the general public, it had to be in local languages. And we couldn't find any translation office that could cover tens of languages. So we decided to make this project online, open for everyone. And we found 50 passionate online participants who helped us translate these into 21 languages and also proactively disseminated them. So what was really a small initiative by a few scientists went very viral. And our fact checks were disseminated to countries that we targeted, where the countries where COVID was not a major concern yet. And our fact check reached them before. And we had learned so much from this campaign. One is that sending fact checks before the rumors arrive can really be effective because it stops people from it's building up that false belief in the rumors. There's no room for the rumors to have to settle down. And we also saw many of the community leaders taking very important role. Teachers were sending us notes saying they were using our infographic in their classrooms with youth. But what was very concerning as we come back to this World Health Summit is that we saw low-income countries were at a larger risk when it comes to exposure of rumors. So on the x-axis, I am showing the countries sorted by GDP per capita from the least to the wealthiest. And then on the y-axis, the response to the question, have you seen these COVID-19 rumors? And you can see a clear pattern. Low-income countries have higher exposure to infodemic. That means these are the very countries that need more resources, infrastructure to handle the virus, and they're even more exposed to the infodemic. They have to handle that as well. And we were able to, as scientists, why do we do this? Because we have been looking into how information propagates in social media. And this is one example that from our research. The figures are showing how a single piece of rumor and a single piece of fact news is spreading. The circles are the users, and there's a link when people retweet or shares. Can you guess which one is a rumor, which one is a fact? So here's the answer. I don't know if you got it. But rumors spread in sporadic network, disconnected network. So once it's spread, it's really hard to contain. This is why we wanted to pre-bunk the rumors before they reach. And facts would spread in very well-connected network. It's really easier to spread messages. So once we have these patterns, then we can use AI, and we use algorithms to get some numbers and give them to fact checkers. And as I said before, we're looking into what are the different data sources that we can use for humanities purposes. And we are so excited about the use of satellite images, and I hope to hear more about this. So satellite images, the public ones, are now available in super high resolution. We're using, each pixel is like 1 meter or 50 centimeter, and you could see so many things. You can start counting buildings, you could see damages after floods. So you could also look into trees. How many trees are there? Are they healthy? What is the climate impact? So there are so much things that we can do with AI for humanities purposes. And this is my final slide, but I want to show one of our ongoing projects looking into Mongolia. So the white circular tents are called gers. These used to be traditional housing for herders in the open field. But some years ago, they started appearing in the city center of the capital, Ulaanbaatar, and it's called the new slum dwelling by the UN Habitat. So these gers have lost their mobility. They keep appearing in the city. Because of their particular shape, it's so easy for AI to detect how many slum dwellings are there and how far they are from the critical infrastructure like schools, hospitals, and so on. So here are some of just one glimpse of the projects that we are doing in our research lab, and we also want to make sure that these outcomes are used by the public, by NGOs, governments, and we also use the best AI for that.
Well, thank you so much, Mia, for sharing these exciting results from your laboratory. Also for the QR code, people can dig deeper and go to the net and find out more. You only have a few minutes then. We expect your wonderful questions, so please prepare. But Jeremy, please.
Yeah, just to sort of change the subject a little bit, I think we should also ask how AI is going to change science. Because, again, going back to the concept of anticipating, science today and science in the future, as a result of the input of AI, I believe will be different. And this comes from a background in those three areas: clinical scientist, funder, now public health agency. And in my view, at least, what science is not good at is at the interfaces between things within the scientific. So biomedical science is not good at linking up with social science. Social science may not be good at linking up with other things, but interfaces are where progress is made. And one of the areas that I think AI may have its biggest influence is opening up interfaces that we do not think, because of our own bias, exist. And if we could use AI to open our minds to what we may not ourselves have thought about at those interfaces, then I think science could open up whole new areas of endeavor, and that would take you another step change. And the second comment, on the more boring level, is I think where AI can make one of its biggest contributions is in mundane tasks. Logistics, which really matter, but nobody's interested in. Logistics, supply chain, cold chain, regulation, speeding up processes. So those two, opening up whole new areas of science, and secondly, doing the boring things, which nobody wants to do, but actually makes the world go round.
Well, thank you. I mean, that the interfaces, that's where the new disciplines are formed. So all you PhD students and postdocs, that's where you need to go if you want to aim high. But please, Roland.
I think just to build on that, I think there's a really important point there around trust in AI in healthcare in particular, because there are lots of different use cases in healthcare, and not all healthcare use cases are equally risky, because there is a massive piece in healthcare in terms of logistics, delivery, bed occupancy, understanding when people are going to get sick, and certain, flu seasons are fairly trackable these days, and understanding when demand, on the system is going to be there and when more capacity needs to be there. That is really, really important, but as you say, boring in terms of operational. And I think that bit is really important. To your point, Lucy, you were making around how you actually strengthen systems in terms of delivering this kind of capability, I think there are 2 points that I'd make. And one is around education and training. And I think making sure that all users are, first of all, aware of what this technology is and what it can do, but also are trained in delivery. So we opened up our first international skills center in Cape Town last year for delivering cloud training AI. We've got a training program going on globally to train 29 million people around the world for free in cloud computing skills by 2025. We've now trained 31 million people, in fact, and 2 million people on AI training in particular. To democratize access to knowledge is really important. But then it's also providing access to the tools themselves, because a lot of the low and middle income countries don't have the capacity to build giant supercomputers on premises and to have access. And that is a gate to this technology. And so this is where cloud can actually bridge that gap. And so we're seeing in a lot of low and middle income countries that are leveraging cloud computing, they are able to leverage generative AI technology and to build things at scale, but it requires governments to allow that and the regulatory frameworks to be in place to actually allow the technology to be used. And I think that's also something that I believe is very important, and I'm sure is going to be discussed in the next 3 days, which is how do you allow countries access to the technology? To your point earlier about the transformation Germany is taking place at the moment around digitizing, that is also true of other countries around the world, and how that can be done to allow access to the technology whilst also having safeguards in place to those that are using it.
Thank you. Lucy, before we start with questions, you had a comment.
So just the issue of the boring is actually that which keeps the system running. And another example that my friend in Cape Town gave was to do with policies. So health systems are riven with policies, public sector health systems in particular. They shape everything that happens in the system. And one of the other positive examples of AI that he gave was the training, again, I think of a bot, and forgive me if I'm using the language incorrectly, I'm an AI novice, that would allow managers to talk to the bot to find out what policy is driving what they need to do if they even are going to order medicine or if they're going to deal with human resource issues. Those things may seem very far removed from public trust in science, but the boring is the fundamental basis of delivering something like healthcare. And if the boring doesn't work, the healthcare won't work and people won't trust.
This is a really interesting use case of generative AI, because where you've got a policy handbook that's 500 pages long, which has been written in great detail by armies of experts that never
in a language that nobody gets.
That no one ever reads it, because it's 500 pages of dense text. And you've got to look up a certain condition with a certain procedure, and you think, we'll just do what we always do. Generative AI is an amazing tool that can dive into information like that, parse it, and give real-world interaction at the correct educational level. So it doesn't have to be for a professor, it can be for, if you log in as a general user, you can actually put in the level of information you actually want to get back. So I think that democratizing access to information is going to be absolutely fantastic. And to the misinformation point, absolutely. So we've been working with a group of UC Davis in the US with the University of Illinois and Pittsburgh on a project called Project HEAL, which not only parses the open source data set around health misinformation, it uses generative AI to create counter information that is factual. So those infographics that you were seeing, if they can be created automatically, it speeds up the process enormously. So I think the capability is really interesting.
I think we need to move now, but you will still be able to, make your points, I think, because I imagine that questions come up. But here's the first question, yeah. Thank you. Can we, maybe while you're waiting for the microphone, I tell you something about a Nature paper that came out that actually demonstrated and quantified how much Donald Trump would distribute fake news, because it's a great experiment, it's a perturbation experiment. You have Donald Trump on Twitter and then he's out, and then you can measure how the misinformation is kind of decaying. And believe it or not, it's a Nature paper and it's quantified, so nobody can say they didn't know, it's just an expression of opinion. But please.
Hello, my name is Dr. Mustafa Kamala. I'm a junior medical doctor and from the Kurdistan region of Iraq, and I'm also a Master's of Public Health student. So we know that for sure a future of healthcare is digital and it's AI. And from one of my experiences from day to day, one of the things that patients care about is liability. Who's liable for treating them? Is it, if something goes wrong, is it the doctor, is it the healthcare, or is it the AI provider that's going to be held responsible? And because at the end, it's their medical decision making that's important from one person to one person. And we know that in medicine, 1 + 1 does not always equal to 2, and algorithms might sometimes treat the disease, but not always the patient. So how can we tackle this liability, and who's going to, because liability can also be one of the foundations for building trust. So my question could be directed to Dr. Jeremy or Dr. Roland or anyone else who would like to answer. Thank you.
Thank you. Liability, who is the one to help us? Jeremy, you dare to help us here?
I'm very happy to start off. I mean, as a physician, as a radiologist, doctors have been using AI and analytic tools in medicine for a very, very long time. And it is, at the end of the day, the physician who's using the tools has to endorse the results the tools are giving them and pass them with their own knowledge in order to give an interaction with the patient. Ideally, technology would actually disappear into the background. You wouldn't see any technology. If technology is almost disintermediating a lot of the relationships care providers now have with patients because there is an interface between. If technology can be used to enhance that relationship rather than get in the way of it or confuse, that I think is the ideal. The problem is we're facing exponential problems at the moment. So year on year, there's a UK workforce census in imaging where the amount of cross-sectional imaging increases year on year 10%, and the amount of number of radiologists or people that can report scans is flat or even declining year on year. And so here is an exponential gap that's occurring that you can't train your way out of. So care providers are going to have to get used to working with technology and in partnership in order to manage this exponential problem that we're facing. And when it comes down to liability, it's at the end of the day, it is the physician or the care provider that's using the tools needs to take responsibility for those decisions.
This question here. First row.
Hi, everyone. Thank you so much for the panel. My name is Renata. I'm a mathematician and a student in Global Health at Harvard Chan. And I actually have two questions. And the first one is that I tend to see some cognitive dissonance when people talk about trust in AI. As a mathematician, I see a lot of people thinking that AI can do everything, that it's magical, and then at the same time, when we talk about the application of it in healthcare, they're afraid and they don't want to trust AI. So I wanted to know what you guys thinking about that. And also, when we think about public trust in science, it's very hard for me to not think about the way we share and communicate science and about our publishing industry, that we all know it's broken and failed, and that the process for tenure. It makes people just basically do a lot of science that is not reproducible, manipulating data and not wanting to share data. So I wanted to know if you guys think that we can actually achieve all of that you were talking about, of democratizing access and being able to actually trust AI, if we stick to the way we share science today.
Scientific integrity. Maybe Mia, you want to answer that?
Yes, thank you for the question. This is a topic that I deeply care, and the topic that researchers at my institute, Max Planck Institute for Security and Privacy, really care about. So some of my thought is that I do think the science should be open. Transparency is really key. So that this transparency is the way that we can build trust in science. It should be reproducible, cross-checked, and that also means that the data used for science and many of the critical healthcare should be made open so that other institutions can also build on top of them and make sure that the data is not biased and it's not, there are no demographic that's missed out. And another thing is that we should be sharing our mistakes as well. Often in research, we are only sharing the successes, but it is the mistakes that almost made it, but didn't work out. Like you're really nodding because we do think that these are not good research outcomes, hence we cannot publish. But if we collectively put these results together, these could also be using AI. We could also learn about what are the best ways to get around the mistakes and make better solutions. The third is that we should be, I really think there's a role that institutions like academia and Max Planck can play here, because we're not driven by profit, and that we have the freedom and we have the long vision that we could have to really look into, is this serving humanity, or is this just another, something that we do for the short gain? So here are, my three things. Yeah, sure.
I see 4 more questions, so please can you be as short, now I see 8 more. Can you be as short as possible? There was one here in the second row and another one in the second row. Where's the microphone? Yeah.
My name is Ingrid Dünning-Toll from the Bosch Health Campus in Stuttgart. I have a question to those two who are working in Germany. In your introductory remarks, Patrick, you said that we are still far behind in Germany. You mentioned as a reason the strict data restriction laws, but also history in a side sentence. Just having been to Estonia, and they have exactly the same law as we have, but of course it's obvious they are much further behind, much further forward. So what is, in your opinion, I look at you two, the biggest hurdle? Of course, we all have many answers to that, but what is the biggest hurdle that keeps Germany from being as progressive as it used to be?
Sorry, can you repeat the last? What is the biggest?
What is the biggest hurdle to refrain Germany from moving forward? Because we are moving forward very slowly.
I can't answer that. Maybe I don't want to answer that. Jeremy?
I can't answer that. But can I make a point, though, to the earlier question and to that question? And many of you will appreciate at the moment, there are some very difficult, very complicated, and very sensitive discussions going on around something called the Pandemic Accord between countries in the World Health Assembly. At the heart of that, going back to your comment about sharing data and open science, which we all absolutely agree with and endorse, but there's a second half of that sentence, and that is benefit sharing. We cannot expect the world to share when there's inequitable sharing of benefits. We cannot expect the world to share, for instance, pathogens when the West is worried, but not share the benefits. And until we answer that question, then I fear that we will not have the equitable world that we want. So sharing of data is critical, but the second half of the sentence is equally important, of sharing the benefits of that.
Actually, these are great answers. Please, short question, please. Yeah.
Okay, thank you so much. My name is Natalie, and I'm leading the young professionals from Ukraine. My question is, are there any discussions when AI is not an advanced tool rather than the only option left, given the fact that, for example, in Ukraine, half of the territory lack of healthcare professionals? So what's your perspective on that? Thank you.
So if I understand, I'm sorry, having some difficulty hearing the question, so forgive me if I misunderstood, but where there are fewer professionals or no professionals, is that the question? Can AI be, is it the last resort almost? Yes. So I think my understanding is that AI and the application of AI can be really an assistance in circumstances where there are no professionals or less professionals, so that there really is a benefit there. I think that it relates to a couple of the other questions as well. We also need people, however. You know, we can get certain types of information. We can use AI to support the provision of care and so on. But we also need people. People offer empathy. People offer reassurance. And so I don't think AI by itself can be a solution to challenges in low-resource settings.
So can I just add to that as well? I mean,
Please.
The WHO has allowed AI tools to be used for TB screening in low and middle income countries that don't have radiologists that are able to read x-rays. I mean, that's a very, very, you know, in terms of radiology, it's not MRI or PET-CT, this is just chest x-rays. They've been around for as long as there have been x-rays. But there just is not access to diagnostics. So there's a Lancet commission on diagnostics that was released a year ago or a year before last that showed 50% of the world's population does not have access to diagnostics. And so if you don't have access to those tools, but you have AI, then you have got to say, well, what's the best thing that you can do in a scarcity? And so in that condition, that's why the WHO has allowed 5 different algorithms to be used for TB screening for chest x-rays. So I think there is a balance to be had that only national governments can answer the questions to when they're faced with these problems.
There was a question here, no, behind you. I think, please, can you just give the microphone to those, because I see them here much better. Yes,
okay.
Please. And then the next one will be in the first row here, but please.
I'm Philip Danso, medical officer from Ghana, and then a student at Charité. My concern today with AI is how do we close the gap between low middle income countries, because even if you have the tools, patients sometimes cannot afford. So if AI screens patient has TB, but the patient cannot even afford the treatment that comes along with it, right? So the gap is so wide, and if AI seeks to benefit more of people in the global north, then of course I will not be motivated to be directed towards that direction, because like my colleague from the other side earlier asked from Iraq, right? Yeah, so the gap is so wide, and at the end of the day, you want to improve patient outcome. So how do we bridge this gap? Then we'll know that, okay, of course, we will not get there, but are we getting there?
Looks to me like, Jeremy, that's for you again. Or who wants to answer?
I can only agree. I think the fund. I mean, Jeremy, you spoke about the need for sharing of benefits in relation to the pandemic treaty. Well, some of the benefits that need to be shared are the strengthening of the basic platforms that then allow the use of AI. AI by itself, as far as I understand, won't tackle those problems. So clearly, we need efforts to address global inequalities in multiple ways. And not only AI, but then AI may have opportunity. There may be more opportunities for benefits from AI then.
Yeah.
I wonder if at some point Jeremy could talk about opportunities in the interfaces as well.
Hello, good morning. My name is Tuntea, a clinician from Ghana. So my question is that as experts, we understand the importance of AI, but the general public, especially from where I come from, are a bit skeptical about computers in general and AI. So how do we package AI in a way that would make the general public more trusting to use them for diagnostic purposes? Thank you very much.
As I said, I think it's really about education at the end of the day. So it's understanding what the computer's being used for, how the AI is being implemented, and demonstrating that it is being used by professionals. So most patient populations have trust. A lot of studies shown that patients have trust in their own doctors, and they're willing to share their own data with their own care providers. They don't want to share data with random companies and doing random things with it. Of course, that's a completely natural response. So I think it's very important for education to be given to all levels of those who are using and engaging with AI, being care providers themselves, those responsible for institutions, so the health systems themselves, and leaders. I think it's important for every level every tier to understand what this capability brings, and therefore to be able to reassure the public. But it's also about public education as well. I think that's a really important attribute.
Yeah, would you like to add?
Yes. So I really think this is a question that everyone is very interested in this room. So I want to add that we have amazing AI which can also generate the fact checks and everything, but ultimately there should be a human intervention, and AI should be used as a tool. And I think EU AI Act is also doing a great job in that it's blocking certain capabilities of AI. AIs have the capability to recursively improve its algorithm, have the agency to move on its own, own way. But there are specific capabilities that by regulation we are blocking because not because AI is not capable of, but because we do not know the consequences, and to make sure that these are not used for malicious purposes. So I think a lot of the checks and balances could go there, including the regulations and also putting things into perspective.
Now we have a question here in the second row, and then the one.
Hello, my name is Hamid. I'm originally from Afghanistan. My question is first for Professor Lucy. In post-humanitarian crisis countries or low-income countries, usually the trust between health system and the governmental institutions is quite low or even struggling. So what do you think how AI can establish that trust, and how can you integrate that trust while they're already struggling with the trust with the governmental institution? And then I would like to know from Dr. Rowland how the private sector, as Amazon services, are contributing to those causes. Thank you.
I expect you know the answer better than I do, to be honest. But I think that if AI can support the demonstration of competence and care and the provision of services, that might then demonstrate to the public at large that the system is working, and that might help to build trust in healthcare, at least, maybe not trust in the government. But clearly the broader environment will continue to impact on that. And so without broader political and wider action in the society to create an environment for healthcare, then I don't understand how by itself AI could contribute that much to that environment. But maybe there are people who can answer that better than I. So,
from the technology side, as a platform provider, we don't want to touch any end patient data. That's not in our wheelhouse at all. And I think the trust that systems have to have in the technology providers that their data will not be accessed without their desire, without their engagement, I think is absolutely imperative. We have to provide the most robust, secure, resilient platform which can be accessed from low and middle income countries, from anywhere around the world, to put power into the hands of the end user, where they can access the data and they can build the latest technology and applications. Because it's really by making the whole ecosystem blossom, and there are some amazing researchers in low and middle income countries that can leverage these tools to have massive impact in their own communities. That is the benefit, I think, and that's the promise of cloud computing, if it can be accessed by the local communities using data that is available to them. I think that is where it would be a great thing to edge towards as time goes by with the regulatory frameworks as they are.
Patrick, can I just come in? Can I just come in on the earlier question about trust? It goes to Roland's point there as well. What moves politicians Professionals like us don't necessarily move politicians. What moves politicians to move in a better direction are communities. Whether in democratic or non-democratic systems, the political system listens to communities. And so I would overestimate the impact that patient groups and community groups can make in moving a system forward. In the early days of HIV, when I first graduated, it wasn't the scientists that moved things forward. It was the people living with HIV that made the difference and pushed things forward. And don't underestimate the question from Germany, the power of patient and community voices in moving something forward and saying we want to share our information, we want to share our data because we want to help ourselves, our families, but we also want to help our communities. So don't underestimate the voice of communities.
I think that's a great point, and I think it's outcomes driven at the end of the day. And so if patients can see that the data that they're contributing to the system is increasing their own health and the health of their community, it will be a virtuous cycle and it'll be a self-fulfilling prophecy. And to your point, if that data is used, but the benefits are not given back to the local society, that will be a non-virtuous cycle.
Yep.
So I think that positive impact will drive future impact.
Can I also just add that I think it's important that the applications that are developed are in response to ideas coming from the community, the public, the health workers, so that it is their needs that drive whatever is developed, because that represents what we actually need rather than what somebody else somewhere thinks we need.
Yeah, we've seen before that new work is generated, right? And that's what we want to avoid. We want to have more time for the patient in the end. Please.
Good morning, everyone. My name is Othman Melouk. I am from Morocco. I'm from the HIV Access to Treatment community, so I'm happy to hear you speaking about the role of communities. I would like to go back to a point raised by Mi Young about the fact that today artificial intelligence is mostly trained from developed countries. And I will go a little bit beyond on the capacity of the private sector or for-profit sectors and strong industries like, for example, pharma industry, the capacity to generate data, to train data, and the risk that, relying or using too much AI for decision makings can sometimes, lead to maybe take it more into mislead, to protect more private interest than the public interest. And if we are here speaking about health, I think access to medicine issues is very, very important. So can you develop a little bit on this? Thank you.
So thank you for that question. So a lot of the research that we do are related to SDG, and they're all connected to health, our global health. And we try to make our outcomes publicly shareable. So we try to produce indexes about economic development in the least developed countries. And we also produce indexes about what do we see from satellite images, and all of these outcomes together with the codes are shared. And I think it makes a good basis when all these codes and outcomes are shared. They can be used as a starting point. But also it is important to have that a lot of these AI models some of them are open sourced, so that future developers can build on top of them. There's no need to start from a huge momentum going into the open source, sharing research outcomes, and I hope this could really reduce the gap in different countries.
Our time is essentially over, but I think there's a very, very urgent, very important question. Maybe if you can stand up so the microphone can be delivered to you. Yeah, to the back. But brief, just
Yes.
a question, please.
Thank you so much. Wonderful panel. My name's Meg Davis from University of Warwick. My question is about the power issues that Jeremy so eloquently raised. I would love to hear some solutions. Let's start talking about how we begin to change governance of digital technologies to make it more democratic, to address data colonialism, these kinds of global inequalities. How can we do that, for instance, through the digital health strategy that WHO leads? Thank you.
That's you, Jeremy.
Are we going to finish up? Because last comments.
Yeah.
So I'll try and address that, but as part of last comments, and then pick up over coffee. We all need coffee, I think. My final comments, really. COVID vaccines in a year, that's an untruth. COVID vaccines were developed because of decades of investment in science. Trust is also built in years and can be lost in an instant. And so these two things have a similar cycle. You don't build trust on a Tuesday when you want it. You build trust by providing good things for people every Monday, every Tuesday, every Wednesday, and not just in a crisis. Anticipating what is coming and not pretending the world is going to be the same in the future is critical, and we've got to get better at that. And then lastly, look around you. It's a privilege to be here. And you'll hear a lot of warm words this week of equity and progress. It's what you do when you leave this room. You all have power, as I do, an agency. It's what you do when you leave here that makes the difference, not what you say here.
Thank you. Thank you. I think this opens our final round, and maybe everybody on the panel, can you just sum up in a sentence or two what's really important that people should remember?
So the panel's about trust, but we've spoken quite a lot about power, and you can't think about the two divorced from each other. And I don't think we fully address the issues of the power inequities that will underpin the way things play out over time. And I can only agree with Jeremy that we all have our own power, and we need, wherever we are, to use that power to fight for greater global equity and social justice as a platform for trust, and then that will provide the basis for the use of AI in ways that support that platform. But without equity and without trust, we will have challenges moving forward, greater challenges. So it's all up to us.
Thank you. Mia, what's your take?
Okay, so this was really amazing to hear about the questions and the amazing insight from the other panelists. I would like to think about what can we do, how AI can, in the future, really boost healthcare and well-being, especially because a lot of countries are becoming super aging society. Now, if we find our healthcare workforce is limited, it's going to be even more limited in the future. And we do not want to replace that human touch, but AI could be used to expand that care. So I'm really excited for my own future that there could be amazing applications developed very quickly.
Thank you. And Roland, last 30 seconds.
Yes, well, I agree that we're living in a scientific golden age. I think cloud really does democratize access to computing, the tools, storage, and AI, and it allows low middle-income countries, it really will allow them to close the technology gap, but they can't do it alone, and governments really need to invest in upskilling and reskilling their populations, and also removing barriers to entry for the cloud so they can access the tools as needed on the ground. It's the only way they're going to make this technology gap jumpable, and that relates to digital sovereignty, localization, residency, which I'm sure will be discussed over the next 2 days.
Well, thank you so much. My last sentence will be that I think AI should be developed for the people, right? And we can all contribute, as we heard, by providing advice, by talking to those responsible, and also giving input, of course. And the other thing I wanted to say is to thank everyone. Thanks for coming. Thanks for joining the panel. Thanks for your insights. And of course, everyone for joining us this morning and for the great questions. And I wish you a great conference, and now have a wonderful lunch where you can hopefully continue the discussion. Thank you all.